Bienvenidos. Welcome to another edition of El Cafecito Corner from Health, Spice, and Life Show, also known in Spanish as La Hora Super Latina, HSL show. And this is your host, Dr. Mario. Well, as you know, from wherever you may be watching right now, it's always so important to me to know exactly where you're at. Whether you're in Venezuela, you're in Guatemala, you're in Puerto Rico, you're in Sweden, you're in Italy, you're in France, it doesn't matter. Love to see where you're watching from. So please do not forget to send a hello. Let me know where you're watching from. And if this is the first time that you've ever seen any of the shows that we're doing, welcome. I love doing this particular segment, El Cafecito Corner, because it's a lot more intimate. I'm here in my home as opposed to being on the TV studio and doing the more TV-like sort of show which we do every week, which airs every Wednesday within the national TV here in the United States, and it's inside the show called The Daily Flash. If you haven't seen that, please don't forget to subscribe to the YouTube channel or here on Facebook if you're watching on Facebook or maybe Instagram. Go ahead and do that so that you can be completely up to date when we put the alerts to let you know that a new episode has come up. And if you're watching on national TV, don't forget that you'll get to see us every Wednesday here at Health, Spice, and Life Show with Dr. Mario, also known as HSL. So welcome back. And as you know, if you're actually not new to El Cafecito Corner, and if you are, welcome to this new segment. We always start by having a little coffee, in my case. But if you're just, a tea person, maybe you're drinking some juice, or maybe you're just driving and you're watching the show and you have a bottle of water, whatever you may be, I always like to say the following: a tu salud. Today, I am drinking some coffee from my native country of origin, which is the island of Puerto Rico. And this one is actually a coffee that is produced in the mountainous region of the island called Lattice. So whoever is Puerto Rican that may be watching this, you know exactly what I mean. This coffee in particular today has a hint of a very, very light cocoa flavors, and also almost like an orangey sort of tinge to it. There's a little bit of a citrusy sort of notes to it, which make it simply amazing. The crema is thick, but at the same time it's really creamy and soft in the mouth. Absolutely amazing. And then you have to drink a little water just to hydrate, cleanse the palate. Absolutely love that. I hope that you're enjoying your drink as much as I'm enjoying my drink today. I want to discuss a topic that is very dear to me. You may know this or maybe you don't. I am a medical doctor. I'm a physician. I'm a Harvard, Yale, and Columbia trained radiologist, and did 2 subspecialties in abdominal imaging and what's called interventional radiology, which if you don't know what it is, I'm glad for you, because that means that you probably have not been sick enough to require those services, which is great. If you do know, well, I'm grateful you know it, because we get to do a lot of amazing things for a lot of people, everything with image guidance. One of the things that I have seen for the past 25 years, which is the issue that I want to bring today and what I want to discuss to make our lives better, is that every time somebody has a procedure, there's a lot of energy and a lot of activity that gets placed on that particular moment. But the fact of the matter is, there is a deficiency that we see a lot, which is what happens once the surgical procedure is done, or the intervention, which is another way of calling a procedure, a medical procedure. What happens after that is done and now you go back to your life? Because if you've had a surgery of some sort, you know that sometimes there are things that are sticking out of you, what we call drainage catheters, or maybe there's a drainage bag that is sticking out of your body. And now you go back to, quote unquote, your life again, but life is not the way it used to be before. And now you have these things that you have to deal with that they're very uncomfortable, they're not intuitive to live with them. And it just feels like you've lost your freedom. And I've seen this over and over again. Some years back, one of my patients brought this to my attention, how this phase of life after having a medical procedure can be so challenging, and it feels like you've been completely left alone. So I started to think about this and talk to some colleagues of mine, and that led to the creation of what I ended up calling the Surgical Drainage Awareness Foundation. I'll say that again, the Surgical Drainage Awareness Foundation. And this is an initiative to educate people, to talk about what are the things that we can do during that phase of our lives where we might have just had a surgical procedure and now we feel completely alone, desolated, we don't know what to do. And unless there's something that goes wrong, which is not what we want, now we're just grabbing the phone to call our physician and go back to the hospital to see who can take care of us. Well, that's not a great situation to be in, and clearly something that we want to avoid. And that's what led to this foundation, which is ultimately geared towards educating the public, also creating materials to serve those people who are practitioners in the industry so that they can serve their respective patients with information that is super valuable for them to take care of patients once they've had the procedures. So today, I want to talk about this. I've gone on national TV and made multiple segments where I talk about what things we can do that are very easy to remember. And I like to think of that as a formula that I call it the ABC formula. So I'll write this here so that you also follow it with me. And it's going to be as simple as ABC. And I'm not joking. I know it's a little funny, maybe a little quirky, but it actually works. And I'll go step by step so you understand exactly what I mean. So the first letter, A, stands for activity. You see, when we have undergone a particular medical procedure, believe it or not, your body has been completely shocked. Something different happened and everything feels off. If you've had surgery, you know exactly what I'm talking about, right? You felt like some people say, I just feel, doctor, like a truck just completely hit me. And what can we do to start going back to feeling more or less the way we felt or just completely awesome again? And the answer to that is we have to do everything we can within the limitations of the surgery that you had. I am not saying, okay, you had surgery, now tomorrow you're going to get out of your bed and you're going to start running so you can run a marathon. No, that would be highly unsensible on my part, right? No, what I'm saying is we have to put our effort and invoke the support of those around, those family members, or maybe somebody who's caring for us after we've had the procedure, so that we can incorporate ourselves back to our life and regain as much activity as possible. That will allow the engine, this engine, your body, to start gearing up again and start the recovery process in a way that it will be expedited. In other words, it will be faster. So rather than having a decline and go downhill after your procedure, essentially you can go up again so you can feel better. Super, super key to have a sense of, I have to do whatever I can within reasonable limits to become active again. When we go from that letter A, and then we're going to go to the letter B, the letter B is super key too. And this is something that is counterintuitive. Physicians, we don't really ask people to do this. And I've done it with my patients for decades, and it's super powerful. And it is basically booking, that's the B, or journaling. Keeping track of what's going on a daily basis. If you are not in a capacity to be able to take the notes for yourself, it is important that this discussion is had with somebody caring for you so that they can keep track of what's happening on a day-to-day basis. Why? Sometimes, doctors, we put in the body what are called catheters, little tubes that take fluid from the inside to the outside. And the quality of the fluid, in other words, the color, the smell of that fluid, how thick or how liquid it is, can tell us a lot of information about what's happening inside of you. Also, how much, in other words, the volume, that can be very telling as well. If there is let's say that you're drinking a little cup of water and you know how much water is there, but what's coming out of you, it's as though there were 10 cups inside of you. Clearly, that doesn't make sense that things are going well. Fluid is coming out of somewhere, and that shouldn't be the case, or at least that's what you were told. If we don't take note of that, while being in the midst of everything can be very, very challenging to understand that something is happening inside of you that may require attention. So that may be the first sign that, in fact, you have to take your phone, call your medical personnel and let them know, hey, something is off here. That is not the way it used to be. The trend, the way things were looking has changed, and I am completely concerned that something is actually not working out for me the way it should, and something needs to be done. So that's really going to be a game changer. And it's almost like having a companion that is with you during this process that it can be so hard, which is a post-operative process. So if you're going through right now a surgical procedure, in other words, you just had it or you're about to go through it, I'm going to invite you to take this into account, the ABC for your post-surgical time. That A, activity, the B for booking or journaling, and the C, as I basically just said a minute ago, is basically the communication piece is going to be absolutely essential to be able to convey that something has happened to you. And grabbing that phone, calling somebody, letting them know is going to be super key. Lastly, we can keep something that may seem perhaps obvious, but in my 25 years of being in medicine, it hasn't been that obvious for many people. And it's the aspect of cleanliness. How clean you're going to keep that area, whether it's dressed, in other words, you have something covering it or not. Because the last thing that you want is just to have an infection in those areas where instruments have been inserted into your body that can lead to other complications that are really not desirable. So I sincerely wish and hope for you that thinking about this in the ABC format, it's a very easy way so that you can think of what things you need to be paying attention to that will allow this process to hopefully be as successful as possible and everything you want it to be. So it's essential to have that kind of conversation. And as I said, this is a slice, it's a component of this initiative that was brought to my attention through treating thousands of people through the years, what to do during that period of your life in the post-operative period. So if you haven't really come across this kind of material, I'm going to invite you to come and visit us at the Surgical Drainage Awareness Foundation. We will put the link to the foundation here so you can come and get some materials there and spread the word. If you know of other people, I'm going to ask you to spread it to 5 people in your life. Share it. People that are going through this, about to go through this, or they have just gone through it and they may benefit from the information, to share it with them, because it can absolutely be a game changer. And I've seen it with so many people that they said, you know, at least now we have something that can help me through this part of my life. So, and it's something that the more we share it, the more we're going to elevate the quality of life of people going through moments like this. So write to us. Let me know, how has this material, how has this information been shared with you change your perspective about having surgical procedures? How something as simple, I'm hoping, as ABC is going to allow you to remember how quickly it is to be able to go through this process in your life with some tools that you did not have prior to this being shared with you. So lastly, and as I always say to you, don't forget to subscribe on Facebook if you're watching there, maybe on YouTube, maybe on Instagram. Send us a message wherever you may be in the world. And don't forget to tune in every single week when our program airs on national TV here in the United States, Health Spice and Live Show with Dr. Mario, also known as HSL Show. So you can see some of the segments that we have and some of the incredible guests that we're bringing to this lifestyle show. I'm sure that you're going to love it. And after all, this show is for us. It's basically to be able to embrace the 1 billion people of Latino heritage and origin, or those who have that inclination for everything Latino, which makes us so spicy and hot. So I'm looking forward to seeing you and hearing your comments or reading your comments here in the different areas where you can find me, and ultimately elevating the quality of your life and your family and friends. As I always say at the end of every single episode of El Cafecito Corner, from my heart to your heart, I am Dr. Mario telling you, a tu salud. See you next time.